Hello, I am Aisha.
And Paula, your cultural hybrid mental health therapist.
Here to explore unfiltered and heartfelt conversations on core issues
that affect us as human beings. Get ready for honest, captivating,
and real stories that take you on a journey to navigate your life
in the best possible way.
So grab a seat
and stay with us on this episode of
Do We Have Your Attention?
Welcome back, lovely listeners, to another episode of the Do We Have Your Attention podcast. I'm your host, Paula, and joining me is the fabulous Aisha P.
Hello. Welcome back.
Why do I feel like it's been a long time?
I know. I am so excited to be back for yet another captivating episode.
Absolutely. I'm excited too as well because we're diving into a topic that's really, really personal to us and just close to our hearts because we both can actually relate to this.
Yep.
And our topic for today or discussion for today is I am a woman and my health matters too.
Yep.
Silence. Let's take that in. But before we get started, I need to check in with you. Aisha, how are you feeling today?
Thank you for asking, Paula. I'm feeling a little gray, gloomy. It's a rainy day today, so
yeah,
it's a very mellow day. But I'm feeling nervous as well. Talking about health is always very triggering in general. But, I'm excited to have this conversation. So gloomy,
same
but also
here.
Optimistic. Okay. No, don't do it like that. How are you feeling? Exactly.
You know how some people, you say, how are you feeling? And then they'll tell you how they're feeling. And you're like, same here. Okay, moving on.
Right. Tell me.
I definitely am feeling a little gray too as well. Gloomy because of the rain. But then also a little anxious because women's health, I'm very passionate about this topic. At the same time, you know how you can be passionate about something, but it means there's so many emotions that are tied to the topic and you don't really articulate yourself well.
Yeah.
So I'm hoping that I can articulate my feelings and my thoughts on this topic without getting too emotional. But I'm also optimistic, so a little bit of gray and yellow.
Okay, well, thank you for sharing. And you know what? It's okay to be emotional. Just let us know how you're feeling and express how you're feeling, and we'll go from there. Does that sound good?
Yeah. Let us say yeah.
Yeah,
sure.
Okay. Okay, well, let's start by letting our listeners know why a woman's health deserves more attention. So, Paula, I'm going to ask you this. Why is it important to raise awareness about women's health issues? Dun, dun, dun.
Because our health matters too.
Oh, yes.
It really does.
Yes.
Okay, let me be serious. But I don't know how do you say this? I don't know how to make it clear enough that for some reason there is serious inequality when it comes to women's health. And to think that we're in 2024
girl.
and this is still the same case, it is a little scary. A friend of mine who's in the hospital actually at the moment because she's close to delivery. She's pregnant and she's close to delivery.
Well, congrats to her.
Congrats to her.
Yeah.
She texted me this week and said, I ended up having to get admitted into the hospital twice in the past 2 weeks because I had high blood pressure.
Oh, God.
And from what it looked like, I wasn't really sure if this was something that they had caught on time or they hadn't. And the first thing that obviously came to my mind was the number of people now, the number of women, especially Black women, that I know that have been in the same
situation
as herself.
Yeah.
And my heart just immediately dropped. Like, I hope you have a doctor. I hope
scary.
you have a good doctor. I hope someone is there with you. But the reason why I bring this up is just because when we think about women's health, there's so many aspects to it that people don't even understand till today.
I agree.
And the level of research and evidence that's actually out there to support women's health, it is very, very either outdated or scarce. So absolutely, this is an important conversation for us to be having.
I agree.
About you? Why do you feel as though it is important for us to raise awareness on this?
I think because everything about our health, like whether it's physical, emotional, mental, they're all aligned together and they all affect the way that we present ourselves in a daily basis and how we interact with people. Like you said, there are health disparities, especially for women. And just with the hormonal changes we go through, the way our body changes, there is just so much about the women's body and our health that I think we need more education on and more advocacy on, because women are really going through a lot when it comes to their health.
Yep.
And I've interacted with several people, whether it's friends, whether it's clients, that have come to therapy because of their physical health, not having any answers, not having doctors listen to them. And that's why it's affecting their mental health. So I think absolutely it's important to raise awareness about women's health, because all of these things are all intertwined together.
Yeah.
And if we don't talk about it or normalize talking about it, then everyone's just going to be hiding and feeling shy, feeling embarrassed, shame, or suffering in silence. And we don't deserve that. We really don't. I don't think we do.
You bring up such a good point, Aisha, about the clients that have come into session.
Yeah.
And then those clients, they come in with, I've been feeling, whether I've had low mood, changes in my mood, this has been happening. And one of the things I've started doing, and I would say fairly recently, taking it a lot more serious. I know when we were getting trained to be therapists, it would say make sure to rule out the physical
health
first before you address the mental and emotional.
Yeah.
But when it comes to my female clients, specifically now, we actually have a lot more psychoeducational conversation around women's health.
I love
and
that.
how that could be really tied into mental health.
Yeah.
And you're right that there's so many times where people will come in and they will talk about their health, and then we'll find out that it was hormonal imbalance. It was that medication. You were off birth control and you didn't realize that that was what was going to affect you, or you actually needed to be on some type of what's it called, hormonal medication. So it's so interesting how intertwined
all of
both
these things are.
And I know there's so much stigma, so much myth around women's health, and it's just seen as, you're being too emotional, you're being
sensitive,
hormonal, or really is it just your period, or whatever the case might be.
Yeah.
So I want to hear from you. What do you think are some key women's health issues that you believe actually need a lot more awareness and advocacy?
I think having free access to healthcare and equity. You know what kills me? That we have to pay for pads, menstrual what do they call it?
Yeah, sanitary pads.
Sanitary products, yeah. That kills me that we have to pay for those things that our bodies...
Even in the bathroom, when they'll tell you to put a coin inside, in the public bathrooms.
It's hello, it's not like I wanted this for myself. This is just how I was designed by God. But then I have to spend extra money. Every month, I have to make sure that I am not only spending money on these sanitary products, but for the medicine, if I have extreme pain, or even if I don't have extreme pain. And then there's the people that experience really, really bad menstrual symptoms. I'm like, why aren't some of these things free for women? It just doesn't make sense.
Yeah.
But I think health disparities, addressing the disparities in healthcare, and there needs to be equity. And I guess according to race as well, I was thinking about as a Black woman, especially in America, I think that we experience some really weird things. I'm not even trying to be triggered and share.
Say it with your chest, because you're making a good point here.
The disparities in healthcare in America it's weird and it's really bad. And there's some things that I've experienced that sometimes it's I take a step back and I'm like, did that just happen?
Yeah.
Because I can observe other people that are not Black in the same environment, not having the same experience as me. And that is honestly, it's very sad. It's very sad. But I think advocacy for policy changes. So I was saying, especially with the sanitary products, or just, I know the screenings we have to do, and just women having access to affordable, high quality healthcare, whether it's for reproductive care, whether it's for mental health care, whether it's for maternal care. There's all these things that I believe there needs to be policies for women specifically, because our bodies go through a lot of change. And I think it's underestimated. / people think that we're being dramatic about it, but in reality, we really aren't. Like these things that we experience, I don't think, no offense, I don't think men could handle this at all. No offense.
Yeah, it's not, see, and that's the thing. It's not, I don't believe it is a thing. Well, there's people who are out there who will say that with the intention of being hurtful. I think what you're basically just saying is that exactly like you had mentioned, women, we go through many, many different changes in our bodies, right? From even preteens. Some people, their own puberty and what's it called, when they start their own cycles, is even way before preteens. So if we're saying that early childhood developmental years is when already we start going through these changes, to some degree, your body is going to be conditioned to have to deal with a lot of discomfort and pain.
Right.
Unlike, let's say, obviously a man who may not necessarily be going through the same experiences. So it's not to sort of speak down on anyone.
No, that's not the intention.
Exactly.
I'm just saying that from my experience with having conversations with multiple men, it seems like they don't understand the depth of it, or they've not tried to understand it. And it can be frustrating because it is seen as we're being dramatic or that we're being extra. But in reality, these changes do affect a lot in what we're experiencing. So, you know,
but if you think about it though, Aisha, the healthcare system, well, to a large extent, also has the same biases towards women.
Oh, for sure.
So the expectation that even men or whomever, even other women, I'm sure a lot of people, I've grown up in a household with predominantly women. Yeah. And I remember experiences where I would have a heavy cycle period as well. And my grandmom and people would sort of share their own experiences like, bending down. Is it that painful? Me, when I was on my period, I'll be walking and the blood will be following me.
It really be your own family.
I'll be looking at them like, that does not sound normal. The way in which what I'm also experiencing doesn't sound normal. Yes. But there's already this notion where painful periods, heavy periods are normalized. And it wasn't until maybe a year or over a year ago that I found out. I was speaking with a gynecologist and she shared with me and said, do you know that periods are not supposed to be heavy at
like
all?
That?
And they're not supposed to be painful at all. Okay. It's almost supposed to be this thing that just kind of happens and you move through. Right. But a lot of women don't experience that. Right. And I was like, huh? Who are you? Are you being serious? Are you lying to me? And I obviously had to go do my research after I spoke with her. Yeah. And I'm like, oh my gosh, you're not lying. So it also just lets you know the level to which where even healthcare, like the system in itself is not really set up to really understand women's health.
I agree. I think there's a lack of education and, again, like you're saying, attention to women's issues specifically. And we only hear about it when it's like extreme. And it's something so simple as, like you're saying, your menstrual cycle or even pregnancy. A lot of people don't understand how dangerous it is to get pregnant / maternal care or postpartum. Like, there is a lot, but there's not much attention to it, again, because those things are not prioritized in society. So it's just one of those things that it's either it happens to you or it happens to somebody that you know, and then you're like, oh my God, you know, I need to learn more about this. There's it's not normalized. It's not a normalized conversation.
Yeah. Speaking of happening to you, have you had, obviously, I know you know mine, I know yours.
Paula, I think you should share. Like you have more. I think you have more experience. I think you should share. So I'm going to ask you the question because I think you should be the one to share. Okay.
See me try to quickly dodge.
I know. I'm like, no, guys, Paula has, I'll let her share by herself. So don't let me spoil it. Okay. The question is, have you personally experienced or witnessed disparities in healthcare access or treatment based on gender?
Absolutely. I'm going to be like, absolutely.
I was about to say, pretends to be shocked.
No, on a serious note, like to be very honest with you, I have what obviously now we coin that term medical trauma.
Yeah.
And it's not just medical trauma. It's not necessarily just trauma experience as a result of an illness or a medical procedure, but it's also as a result of the service being provided during that period as well, where of course you have medical gaslighting, dismissing pain, prescribing medication that can be harmful towards you, and they're not necessarily consulting with your patient in regards to what they need. But unfortunately, the medical provider abusing their power dynamic in a way where it's obviously
Don't forget that part.
towards the patient. Exactly. So I've had a lot, and one of the things that I would mention, because I feel as though we need to have another like a future
special episode.
I always keep saying in my mind, I'm like, one day I will tell my story.
I think you should
tell my story.
If you guys know the shege Paula has experienced with medical.
But the truth is, if I'm in all honesty though, I don't even feel as though I have the emotional bandwidth to be able to sit and have to really go through
relieve that.
I'm 29 now, and I spent majority of my 20s pretty much battling chronic illness. And if I think about it and I look back on this journey of how I got to where I got to, honestly speaking, a lot of things could have been avoided if there was actually not the level to which we have disparity in healthcare when it comes to women's health. I know that there was a lot, to the point where I had a surgical procedure, and honestly, that surgical procedure could have, like, there was no point. It was one. So I'll explain. I got diagnosed with stage 4 endometriosis. That was one. I also got diagnosed with PCOS. So actually, just to explain, because there's a lot of also misconception, and I would say probably PCOS, endometriosis, fibroids, infertility would be the conditions, the women's health issues and conditions that we need more awareness and advocacy around. I know there's a lot more as well that's out there. Obviously, I'm a little biased because this has been my experience. People think endometriosis, for example, is a reproductive health condition or disease. Now, does it predominantly affect your reproductive health and organs? Yes. But endometriosis can be found in your lungs, it can be found in your intestine, it can be found in your bladder, it can be found in other organs around your body. So it's a chronic condition that, unfortunately, where the tissue, similar to the lining of your uterus, but it grows outside of your uterus instead.
Oh, wow.
And unfortunately, as a result of that, I think we used to call it, what I used to call it was like bad estrogen that becomes endometriosis. Now, that's just my own, subjective way of explaining it. And as a result of these, tissue linings growing outside of your uterus, it eventually becomes endometriosis, which is like a tumor. And when I say tumor, not benign, it's not nothing that's cancerous or anything like that. I think to some degree there are people who actually have, in rare cases, have had, unfortunately, actually it be cancerous. But it can lead to inflammation. It can lead to you developing cysts, fibroids. Honestly, in my own case, it actually even pulled my organs. When I had one of my scans done, finally, when I was about to have a surgery that was actually going to be helpful, I had seen that apparently my ovary, I think it was maybe my left ovary, I just noticed there was left side pain for so long. And my doctor in the imaging had shown that like the ovary had sort of gone up and pulled to the left side. And I was like, what the I don't understand what's going on. So I don't want to dive too much deep into my diagnosis, because where I'm going with this is, yes, unfortunately, during that period of even just trying to get diagnosed with endometriosis, because I didn't even know what it was, they would tell me and say, oh, you have to have surgery for you to be able to get diagnosed. That's already a problem. The fact that the healthcare hasn't really figured out
what do they mean by have to have
which
surgery?
They can accurately diagnose women's health issues without having to put them under the knife. It's already a very, very big problem.
It is.
So unfortunately, I had to have one of the procedures where it's called ablation. Now, if there's any woman out there who has a diagnosis of endometriosis or thinks that they have endometriosis, ablation, what's it called, is actually one of those surgical procedures that should not even be allowed today.
Yeah.
But guess what?
They're still doing
Because
it.
of money, I'm
my
just going to put it
God.
out there. If like, shoot me after this.
Oh God!
I mean,
God
I don't
forbid,
mean literally
nobody's going to shoot
speaking.
you.
I mean literally speaking. I don't mean
But
literally
you're not
speaking,
lying
rather.
though. But that's not.
It
so
should
I
not
mean,
be allowed. Like
I feel like anybody listening that
it is very
yeah.
important to say this. Like, ablation surgery should not, any sort of ablation type of surgery for endometriosis, adenomyosis, it should not be allowed. But because they consider, but this is how they present it, it is easily accessible, easily affordable compared to the one that's more widely known and obviously has more research and evidence to back up, which is excision. So there's a very big difference between ablation and excision.
Okay.
And unfortunately, because of cost and availability and also who's trained in excision surgeries, a lot of people do ablation. And unfortunately, I was one of those people. That was one of my first experience, did ablation. They said 4 hours, she'll be out. Apparently, I was there for maybe 8 hours.
Oh, my God.
I didn't know that my parents at that point in time were like, yay.
Yeah, they were going crazy.
Something has happened. Because obviously I was under.
Please don't. But that's a long time.
A very long time. And the truth is, even after the surgery, my recovery from that surgery was so traumatic. So let me just even start with that.
Yeah.
And in my mind, being someone who had been in chronic pain and chronic inflammation, anything, there's like a desperation that sometimes happens, especially for women, because our pain is not really, where our pain is not valued. The way in which, if let's say, obviously a man, and I've had many situations where people would share their experiences as well, endo survivors and endo warriors, we call them, and share that, oh, they only listened to me when my husband was in the room, or they only listened to me when my dad was in the room, or they put anxious patients on my chart because I was telling them how bad my pain was.
God.
And that was something also very similar that happened to me, where a doctor of mine as well, who was working with me, an excellent surgeon, but very, very biased towards women's healthcare. And that sometimes that can happen where you have someone who's excellent at their job but honestly speaking, has a lot of bias towards it. And said, I think you're just being like, you're overreacting. And then we'll ask my mom, like, is she an anxious person?
Oh
like,
my God.
And then we'll talk about going on this medication and going on that medication for anxiety. So I started to already kind of understand that, there's a difference between how they treat women and then also how they treat women of color versus how they treat other genders.
That's
it's just the truth. From even going into the hospital and waiting for years. I said years. Yeah, it felt like years, to be honest, because you've been there with me, so you know.
Yeah.
Waiting for hours. I've done 10, 13 hours in the hospital before they finally got to treat me or to figure out what was going on with me.
Yeah.
And I know that can be a very sensitive conversation as well.
Yeah,
because unfortunately, there's a lot of women and a lot of people who are still going through this, suffering just the disparity and the inequality that comes with healthcare, especially with women, and don't even have the access and the resources to even get the kind of help that they need. I even am grateful and blessed enough to have parents who were like, you know what?
Everything.
Whatever it is that we have to pay and whatever it is that we have to do, we're going to have to do it to get you the best surgeon. And all I just kept thinking during those periods was, what about the people who don't?
Right.
And unfortunately,
there's a lot.
There's been a lot of people, women, who've lost their lives as a result of this. So as much as obviously we're chatting and having this conversation, the reason why the disparity conversation in women's health is important is because there's a lot of women who've lost their lives, whether through chronic illness, reproductive health issues, whether through childbirth, pregnancy, postpartum, or even the impact of childbirth too as well. It's a lot, and it's unfortunate that we even have to still be having this conversation. But here we are. Here we are.
I know. But you know what? Thank you for sharing that and being very vulnerable. I mean, I know you were kind of sharing it and we were like laughing a little bit, but yeah, I remember those days when you were going through those specific surgeries, and like I remember the frustration when you were telling me like, I just found out I didn't have to go through that surgery, and now I have to be on this not permanent, like I have to be on this medication long term, and all the money that you spent. And you're absolutely right that there's some people that have been put through this for no reason, have spent thousands of dollars, naira, whatever money you're using in whatever country you are in, and now they're telling you, oh, we didn't have to do that surgery. Like that is extremely painful.
Yeah.
And from what you were saying, I was just thinking about how much trust we put in doctors, because they're the professionals. They're the ones that we trust, just like our clients would trust us as therapists. So initially when they tell us things, we're like, oh my God, I have to believe them. This is what they're saying. But something that I'm hearing from you is a lot of times we do have to do our own research. Yep. Yes, you want to be trusting of your doctors. Yes, you want to believe that what they're saying is for your own best interest, but you also have to put your own research in and find out what you think would be best for yourself and consult with your doctor. And you know what I always tell my clients? Always get a second consultation and third and fourth, because that first doctor, especially with watching you, and my little sister has been through some health issues as well. Watching what both of you have gone through, I've been like, yeah, one doctor will say something, another one will say another thing, another doctor will say another thing, and I'm like, bro, which one is it? So then now we have to sit down and start Googling and looking and blah, 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 and be like a lot. And I think it's so painful because they put you on medications, like you were saying, that could be harmful. Like my sister is still experiencing side effects from medication that she was put on for no reason. Yeah. And it's very annoying and frustrating, because why did you guys do that? We trusted you and believed that this is what would have been best for our health at the time. But now we're recognizing that, no, you just did that because it was kind of like on to the next. We just want to get rid of this client and just say that we've done what we could do and blah, blah, blah. And it's like, no, there's no care. Yeah. Where are the doctors that care about us? Yeah. Where are they? Especially women. And I think you're right. I think it all comes back to the stigmatization. And with what you're saying, I think that's why a lot of women specifically want women as your doctors, because there's some things that I've experienced with male doctors and some things that my friends have told me that it's like, first of all, some of them are rooted in misogyny. Like, hello, you're asking me some stupid questions. Like, it's just the truth. You go to the doctors for pain, menstrual pain, and they'll be like,
how many sexual partners do you have? Like, when was...
Like, what do I have to do with anything? Hello, I'm in pain.
Oh my God, I have to say this. I have to say this. And like, I know it's such a sensitive conversation, but you're so right about that medication and the impact as well. Like, till today, and you know this, Aisha knows this, like, till today, I'm still suffering the impact of being on trial medications and this one and that one.
Lord.
Gained 60 pounds. And till today, the 60 pounds has not gone because I'm still on one medication is hormonal. So unfortunately, as a result of that too as well, it messes with your body. And the crazy part is we don't also know the long-term effects of these things. Yeah. So, of course, I've always had at the back of my mind where I'm like, just God, please, the one thing I'm begging you, because you see this one, it will say susceptibility to cancer. You see this one. But unfortunately, if you're also not on some of these medications, my body is overly producing estrogen in a way where it becomes bad estrogen. So they have to manage it to some degree. So it can be very, very confusing. And it's because they haven't really taken the time to figure out and value, just value us as women and value our health enough to know these things. Right. And what you said about finding providers, and I know we're pretty much talking about preventative care and measures and things to do, action plans. Finding providers too as well that are going to listen to you is so important. I'm not saying that we're being biased, because I've had situations where I've had women doctors and that was a horrible experience. I've had situations where I've had a male doctor and that was a great experience. However, if I'm being honest, my healthcare team, because I have a lot of people on my healthcare team, are predominantly women for a very, very serious and real reason. My endometriosis specialist / GYN is a Black woman for a very, very real
specific reason. Yeah.
And I would never forget having a doctor in the hospital and who's supposed to be specialized in women's health, which is so funny, was doing a vaginal ultrasound for me. And had said, oh, do you want me to leave the room? And because I was going back to what you said about misogyny. And then my friend was there and I was like, yes, please, can you leave the room? So I like change before he does the examination. And he laughed and was like, it's not like I'm not already going to see everything.
Excuse me, that's inappropriate. Huh?
And my friend and I looked at each other like, we looked at each other like,
Paula, this is a joke.
Did this just happen? But you know the worst part about this is the fact that like I was in so much pain that
you just
if that was the only person available also, that still ended up being the person who did my examination. So I've had many times where if I'm being very honest, that there were violations, like you felt violated during these examinations and tests because you're just looking like, this is a little strange. Something doesn't seem right here. Yeah. So when you're saying things being rooted in misogyny, you're not lying when you say that. There's so many people who've had these experiences. And this is why we really need to be our own advocates. I don't joke about it when I say be your own doctor.
Advocate.
Ask your own questions. Do
your own research.
There's no stupid questions. And if you have a provider who unfortunately is getting annoyed by
which
you
they
asking
do,
questions,
by the way.
Which they do.
They do, but you have to just stay straight, stand on business. Yeah.
So many of them that would literally just put me as anxious. So they use that as a way to label anxious because I would ask questions.
Horrible.
But now I can say that because of all the work, all the stress, all the trial and errors I'd gone through, I finally started finding providers that actually cared enough to even be of support to me. But unfortunately, and I want to just put this out there, that it's already unfair as women to even put the onus on us to have to be our own experts and our own doctors and have to advocate for ourselves.
Yes.
That is already part of the disparity in the sense where we should be able to trust our providers. We should be able to go, I'm the patient, I'm in pain, I don't have to think about anything else but you helping me. Let's collaborate and figure out what is going on. But to think that we have to go into appointments actually on guard because we don't know if that person is going to be someone who unfortunately is adhering to the issues that are stemming from this inequity that's happening in our healthcare system. Or if this is someone who actually gives a about their job enough to know that they have the responsibility to actually make sure that you are okay. And it's unfortunate. I really just want to shout out women who unfortunately are going through these experiences from whether healthcare, mental health, whatever the case might be. Because unfortunately, we're going to have to now take on that onus already on ourselves to have to be advocating. And it's not fair. It's not right.
It's not. But I just want to say, please don't give up. Keep asking your questions like Paula is saying. Keep doing your research. Keep looking for other people who are being vocal about their experiences because at the end of the day, it almost seems like they want you to give up and kind of just accept whatever mediocre treatment that they want for you. And it's like, no, because people have truly lost their lives. People are going through excruciating pain for no reason. And that's because after that first appointment, the disappointment or, the stigmatization from the conversation that you have with your provider just makes you give up. Please don't give up. Please keep advocating for yourself. Like Paula is saying, you have to be the one that's standing on business, as they say nowadays, stand on it because your life truly depends on it. Your life really depends on it.
Absolutely. And as we're rounding up this conversation, just what are some tips for just preventative care as well? And I know we grew up in environments where our parents clearly had no idea anything about menstrual cycles. They clearly, I never had a conversation, so I guess maybe that's one.
I didn't. Did I? I don't think I did. No. I'm really thinking about it. It's just kind of that awkward conversation where it's like, oh, you're not praying. Because I'm a Muslim. We don't pray when we're on our periods. Like, oh, you're not praying. Oh, okay.
Moving on.
And then my dad, I remember one time when I was younger, my first really bad period pain, he was so anxious. He didn't know what to do. He was like, every time he sees us in pain, he's like, oh, what do I do? Oh, yeah, let's go to hospital. I'm like, oh, look at you. But this is where the education comes in. Oh, seriously, men.
But shout out to your dad, because my dad did not even know any of these things. Did not even have any idea.
Nah, my dad used to be so nervous. Still is. Like, even now as an adult, if he's like, oh, you're on your period. Pele, shoti wa shekini. Have you used this? Have you used that? I'm like, oh. Yes.
No, but early conversations, taking kids to the doctors already to teach and educate us on our physical health, emotional health, mental health, how just all these things just interconnect with one another. I think the earlier, the better. The more proactive we are, the more we can really avoid a lot of things that unfortunately down the line we might experience.
I agree. So early education can also help with early prevention. And I want to say, please, people, do your checkups. I'm literally begging you. A lot of people avoid checkups and they're like, I feel good. Girl, you don't know if you feel good unless you go to the doctors and do all
early detection.
Early detection, do your routine physical exams and like your blood work. Please,
so true.
Please do your annual checkups and also your gynecological care. Hey, did I say that right? Did that sound right?
Yeah, gynecological care.
Yeah, that. Please, though, if you're over 25, do your pap smear, please. These things are very important.
I have mine coming up in 3 weeks.
Track your menstrual cycles. Because that really can be indicative of something going on with your body.
Absolutely. Like cervical cancer screenings, things along those lines.
Yeah.
So you're not lying.
And get your vaccinations, HPV, please. Please, we're here just trying to encourage people to really take care of themselves.
Public something announcements.
PSA. PSA. One last one I wanted to say is blood pressure.
Yeah.
Because Paula and I have been having conversations about blood pressure recently. You want to tell them why?
My blood pressure spiked, and I honestly think it's also because of one of the hormonal medications I'm on. Because since I've been on that medication, I know, and obviously stress as well, cycle, hormones, all of that plays a role as well. But it is very, very necessary because one, as women of color, we're already disadvantaged as women, and then as people of color, we're more susceptible to even blood pressure, high cholesterol.
Exactly.
So these are things where it's not you being over the top by making sure that your health is okay. It's actually you being smart.
Exactly.
My grandmom always says, well, she's 87, so she can speak. 87 and living life and very healthy. She always says, like, it's better to be safe than sorry.
Please, I'm following grandma with that one. Yeah. Preventative care is so important. I can't even stress this enough. For any health issue, mental, physical, emotional, it's always better to just prevent anything. Because now when things have developed, then you're like, sometimes there are no answers, or sometimes you may not get the appropriate help that you need. And that's always very disappointing and can lead to more issues. And we don't want that. But this has been a very lovely conversation. I enjoyed talking about it.
Get your health.
At the end, PSA.
All these doctors, good doctors, bad doctors.
Women, we love you so much and we want the best for you. We know, we understand the struggles. We just want the best for every woman out there. And that's why we're PSAing. You know, Paula, what's one thing you want women specifically to take out of this conversation? One thing that you would like them to take out of the many, many things we talked about?
Just autonomy and agency. I'm a very big fan of autonomy and agency. Don't let anybody ever tell you that you don't know your body. If you know that something is wrong, like we have autonomy and agency over knowing just when something doesn't seem to add up, like don't be afraid to speak up about it, ask questions about it, clarifying questions. I've done that and I have honestly saved my life as a result of that.
Love it.
That's what I would say. How about you? That's a great question, by the way.
I think I'll follow kind of one of the things that you touched on, which is trust yourself and listen to your body. Do not underestimate any symptoms you may be experiencing. It may save your life. And lastly, I would like to say, please support your friends that may be experiencing things that you don't understand and try and help them and support them. And support may look like finding research, following them to appointments, following up with the checkups or advocating for them if they're at the point of giving up, please support your friends because it can be very tiring. But most importantly, listen to your body. And yeah, that's what I would like to end this on. Okay. Thank you all for listening.
Thank you. I appreciate the support that you gave me as well in having this conversation. And we obviously would love to hear from our listeners, your experiences, your feedback, your thoughts, your feelings. And we know that this might be a sensitive conversation for some of us, but we also understand that by having conversations like this, it really implores you to actually start being a lot more proactive about your health.
Right.
So, Aisha, how can our listeners connect with us? Let them know.
You can connect with us on X, formerly known as Twitter, Instagram, YouTube, TikTok at DWHYA Podcast. TikTok has one on top at the end. So it's DWHYA Podcast 1 on TikTok. And yeah, we'd like to hear your feedback, thoughts, comments, questions if you have any. And I
how
think
you're
that
feeling.
Was it. Yeah. How you're feeling.
Why are you giving ASMR voice as you're saying, connect with us?
This is the end. This is the end. You have to kind of, soothe. You caught me. My voice
okay, as we're signing out, just one feeling word. So just one word to describe how you're feeling.
I'm feeling empowered. Having this conversation as a woman with a fellow woman about women. Wow,
that's a good one.
What about you?
That. I'm feeling grateful that I've had experiences enough to be able to share them. Pretty much just highlight the seriousness of why our health matters too.
Yeah. And on that note, we're going to say bye.
Bye for now.
Bye for now.